Hello everyone, welcome back to my channel Gladiator in Scrubs. Today we will be diving into the discussion and topic of schizophrenia. This is a complex mental health condition which affects millions of people worldwide, yet it is often misunderstood. So let's break it down. So what is schizophrenia? Schizophrenia is it's a chronic brain disorder that impacts how a person thinks, feels, and behaves. So, contrary to much of the misconceptions out there in the world, it is not the same as having multiple personalities. In fact, it is kind of a range of symptoms that can vary greatly from person to person. So one way of sort of understanding schizophrenia is to categorize its symptoms into two main types. So there are positive symptoms for schizophrenia and there are negative symptoms for schizophrenia. So the positive symptoms are people experiencing symptoms that are added to a person's sort of behavior or thoughts. And these are things like hallucinations, delusions, disorganized thinking, and abnormal movements. So people who are experiencing these positive symptoms, such as hallucinations, that includes seeing, hearing, or feeling things that aren't real. Delusions are just false beliefs that a person holds despite evidence to the contrary, despite evidence that whatever they're feeling, whatever they're seeing, whatever they think is going on isn't actually happening. They still continue to believe it. For their thinking, disorganized thinking can be or can make it difficult for individuals to sort of organize their thoughts and express themselves in a coherent manner. And finally, we mentioned movement, abnormal movement. So these can be like repetitive gestures or sort of catatonia, which is kind of this state which someone goes into. Typically, people with catatonia does not move a whole lot. They are usually mute and may not respond to your directions or commands. Negative symptoms for schizophrenia, on the other hand, involves the absence or reduction of somebody's normal behavior or emotions. So these can include decreased motivation, social withdrawal, reduced emotional expression, and difficulty experiencing pleasure, for instance. Now, let's talk about treatment for schizophrenia. So, schizophrenia has no cure. In the beginning, I mentioned it's a chronic mental health disorder because there is no cure for schizophrenia. There's nothing you can give someone to let their schizophrenia go away. However, you can provide medications that can manage symptoms and improve people's quality of life. Just help them to be able to function in the real world. So medications for treatment of schizophrenia, primarily this would be antipsychotic medications. And these medications are essentially given to target symptoms like hallucinations and delusions. And you can certainly bring in other aspects of treatment like therapy, such as cognitive behavioral therapy or dialectic behavioral therapy, supportive therapy. All of this come together to help someone cope with their experiences, manage their stress, and improve their social skills. There are some old generation, which we call first generation antipsychotics, and there are new generation, second generation antipsychotics. There are even some third generation ones just coming out as well. Essentially, the main differences between first generation, second generation, so forth, is that the second generation medications tend to have less side effects. Well, less side effects in terms of issues with people's movement. Um, Antipsychotics are known to cause abnormal movements in people, which are known as extrapyramidal syndrome or symptoms. And these movements are abnormal side effects, and they're pretty common for first generation antipsychotics. Of course, their treatment to help with that, to relieve the side effects and things you would be looking for when you give somebody first generation antipsychotics such as haloperidol. You want to make sure that they're not having any stiffness in their joints. So you want to check their range of motion, making sure you're able to turn their heads and so forth. They're able to open their mouth, able to speak normally. Their tongue is not like swollen and blocking their airway, and that which would be kind of an emergent situation. Or they might have oculogyrate crisis, which is when their eyes kind of like roll back into their head, and that's an emergency situation as well. It may cause laryngospasm, quite an emergent situation as well. Yeah, so those are some of the things that you want to look out for. Tremor, and you can treat that with anticholinergic medications such as benztropine, otherwise known as cogentin. Second generation antipsychotics, of course, still has side effects, but the side effects tends to be more metabolical. So what I mean by that is that it tends to cause issues like weight gain. It may affect people's insulin. It tends to cause issues with electrolyte imbalances, those kind of metabolic issues that it may cause. And some examples of second generation antipsychotics is like clozapine, olanzapine, and risperidone. By the way, all of those three medications are kind of high alert in a sense, because they all are very much known to cause weight gain. But, again, there are ways to help people manage those side effects. So, in addition to lifestyle changes, such as maintaining a healthy diet, exercising regularly, getting enough sleep, avoiding drugs and alcohol use, all of this can play a tremendous role in symptom management. If people are using drugs, typically, and I mean illicit drugs like street drugs, typically medications that are being provided might not have the same effect, and alcohol overboard or overall does affect most medications. You do not want to be using drugs and alcohol taking these medications. So, it is very important to remember that recovery looks different for everyone, and it involves trial and error. So a lot of the times you get medications and a combination of treatment, and you may not see that it works well for one person, but it may work better for others. And this is what it is. There's some trial and error to get into the right treatment, because everybody's case is individual, and so he needs a lot of professional support, collaboration with family, friends, patient, everyone, to try and get on board with a treatment plan for somebody. We want to help people or lead them to fulfilling their lives in the community. So yeah, that's schizophrenia, and we'll continue to discuss other mental health disorders, just for sharing, learning. So thank you for joining me today on my channel talking about schizophrenia. If you found this video helpful, please don't forget to like, share, and subscribe for more informative content coming your way. Take care, and we'll meet again next time.